Hi, good evening, everyone. Welcome you all to this webinar. So the topic about this webinar is going to be opportunities of medical licensing in US for doctors. We have Mr. Shyam Kumar, who's the CEO of Texila, and he's going to enlighten us about the opportunities, how you can get into US. Whatever queries you have, you can ask him, and he will be able to provide all the information and what are the easy pathways through which you can get in. In case if you would like to talk, please raise your hand so that we can, unmute you and you can go ahead and do that. I'm sure it's going to be an enlightening webinar. Thank you all for joining us. Over to you, sir.
A very good evening to everyone. My name is Shyam Kumar, as Anita mentioned. I am the CEO of Texila American University. I've been in this foreign medical education industry for almost 20 plus years. I've worked with students who are currently pursuing medical education and also who have gotten into residency programs also. I'll try to make this session as informative as possible for you while you pursue your pathway for medical license or medical practice in the US. I'm assuming some of you, or at least most of you, might already be either or already would have completed your medical education or in the process of completing your medical education. Now, this session will focus mostly on opportunities that exist for medical graduates to eventually practice as a physician in the US. That will be the core focus of this discussion. Presentation can run for around roughly around 30 minutes, and then we'll open for question and answers. I have roughly around 20 slides to present, so you can leave all your questions towards end. I think Dr. Pradhiva Singh, I think raised her hand for a question. We can leave all the questions towards the end of the session, and then I think we'll have enough time to answer any questions. Okay. Well, again, this topic is opportunities for or demand for foreign medical doctors in the US. We're going to talk about basically three concepts or three areas for this presentation. Understanding the physician shortage in the US, which talks about, is there a demand? What is the demand? How is it happening? How the foreign medical graduates are meeting the demand, and the process of medical licensing in the US. These are the three core topics that we'll cover in today's session. And again, of course, there are some subtopics also. This is actually, we found an interesting quote from the AMA president. AMA is the American Medical Association, which is the largest body that manages all the medical doctors in the US. It's a quote that came last year, made by Gerald E. Herman, who's the president of American Medical Association. Because it can take up to a decade to properly educate and train a physician, we need to take action now to ensure we have enough physicians to meet the needs of tomorrow. I think the quote is self-explanatory. And then let's get to the current situation of shortage in the US. Now, unlike a common belief that everything is developed, everything is nice in the US, which is clearly is not the case. There are still some places where we call it underserved areas and so on, where there's a huge shortage of healthcare properly. More than 83 million people in the US lives in areas in which access to primary care physician is scarce. Now, most of you might already know what is a primary care physician. In case you do not, it's generally your family practitioner or internal medicine practitioner, who we call as a PCP or a primary care physician. 83 million people still don't have access to a proper primary care facility. According to data presented by AAMC, American Association of Medical Colleges, AAMC every year publishes data on what is the expected shortage, physician demand, number of doctors, and so on. And last year, as per their data, US is expected to have a shortage of 125,000 physicians across all specialties by 2034. And now, with the whole purpose of this data is to plan accordingly as healthcare professionals, healthcare workforce, healthcare policy makers, to see how they can mitigate some of these challenges and some of these problems. So as per AAMC, by 2024, there is an expected 124,000 physician shortages. In that physician shortage, primary care between around 17,800 to 48,000 physicians will be needed. Primary care, again, as I mentioned, PCP, primary care physician, generally is somebody whom you will run into when you have a basic problem. Most of the systems in the US works on you seeing your primary care physician initially and them referring you to a specialist. That's a generally accepted trend. Even some insurance companies will require you to see your primary care physician first before you can even see a specialist. So primary care, there's a shortage, roughly around 17,800 to 48,000. Non-primary care, around 21,000 to 77,000 is the expected shortage by 2024, in which surgical specialties is around 30,200, medical specialties, cardiology, oncology, pulmonology, and so on, roughly around 13,400. Other specialties, anesthesiology, emergency medicine, and so on, around 35,600. This is the total expected shortage of physicians in the US until for the next 10 years. And this is not 20 years, 30 years down the line. Okay, this is for the next 10 years expected physician shortage in the US. Again, physician shortage is an accepted trend in many parts of the world, which happens because of lack of proper medical education system or enough seats in the medical education system. But it has a huge impact on the primary medical care system and public health crisis. I hope you all remember, or we all remember, the impact of COVID and the huge impact it had on the US in general, especially New York and New Jersey area, where it created a lot of impact, a lot of challenges. So, when there's a public health crisis, this shortage creates a huge challenge for doctors. Actually, I was living in New York at that time during the COVID, and man, I saw the direct impact it created for a lot of lives in the US at that time, in New York at that time. And what are some of the reasons? Why did this huge shortage happen all of a sudden? Um, Human life expectancy is longer than ever before, and as the population ages, healthcare needs are increased. Again, as you know, we are all gone are those days when somebody would pass away. With all these advancements in healthcare, life expectancy is much more statistically, and of course, then there are more people to be treated. Growing number of practicing physicians are nearing retirement age. Again, from a US perspective, it is said that around 18% of the physician workforce will retire within the next year or so. Again, that creates a huge gap, huge vacuum on the physician workforce in the US. Well, the current trend in healthcare challenge also does not help the cause in any way. Approximately 6 in every 10 adults live with one or more chronic conditions, which should be treated, which means more physicians. When there are more healthcare challenges, you need more and more physicians to treat the problem. Finally, and most importantly, access to medical school. US system, has a huge shortage of medical seats. Roughly every year, there are roughly around 20 to 25,000 medical school seats available for new medical students in the US currently. And we receive roughly around 50 to 55,000 applications every year. So I always make fun of it. I say that US medical school admission is a denial process than an application process, because the whole idea is to deny students, then get students into the program. So yes, there's a shortage of medical seats in the current US system. Now, what are the systems currently in place to mitigate this challenge, mitigate this shortage? One is there are alternative healthcare systems currently in the US to help this cause. Non-physician programs. You might not be exposed to it, but assuming many of you are doctoral or healthcare practitioners, you might have heard about this. In the US, there are something called as nurse practitioners and physician assistants who are not your primary care physician, but they can do almost all the functions of a primary care physician. For example, if I walk into an emergency or urgent care today, the most likely I'll be seen only by a physician assistant who can prescribe medication, who can do all my initial vitals and everything, and they can also prescribe medication. Same is the case for nurse practitioners. So what they're doing is they are using these as an alternative option for a lot of practicing physicians. I still remember, 10 years ago, if I go to an urgent care or emergency, it's mostly MD physicians. That is not the case now. All these urgent cases are all manned by physician assistants, or what we call as PAs, or nurse practitioners. Another opportunity that the government is providing is, as you might already know, or if you do not know, most of the American students take student loans for their education, be it medicine, be it engineering, any course. They take a lot of student loan for their education. That's how the system works. That's how the concept works. The concept of parents saving money for their kids' education is not common here unless you are pretty affluent and wealthy. So the government often offers debt relief programs. Hey, if you have a student loan, we will give away if you can, work in certain areas of practice and so on. Another, and the most important, because US medical schools are having a hard time keeping up with the demand of new doctors, medical school hopefuls also have option to pursue foreign medical education. Now, Caribbean medical education system is a classic example of a system that supports the entire US healthcare workforce. There are a lot of medical schools in the Caribbean region. Their primary goal is train physicians in Caribbean so that they can practice medicine in the US. So as long as you are a physician from an international program with proper school accreditation, you can eventually get into US residency programs and become a practicing physician. I'll just talk about some data that I would like to present in terms of how foreign medical graduates are meeting the demand. This is 2023 data on matches by specialty and applicant type. Now, what I mean by matches, which I'm going to explain in the next few slides, matches essentially you are successful or your success in getting into a residency program, which is your postgraduate training program. Here, postgraduate training is mandatory for you to practice as a physician. After the MBBS, practicing as a physician doesn't exist. So, which means after your basic medical education in the US, which is an MD degree, after that you have to complete a postgraduate training program for you to practice medicine in the US. So, this data is on those foreign students and American students who matched into the postgraduate residency program in the year 2023. You can see total around 8,000 foreign medical graduates matched into almost a 34,000 number of seats available, which means roughly around 25 to 30% of seats are filled by international medical graduates or foreign medical graduates. So now this is an opportunity that exists for a lot of students, a lot of physicians from abroad who might want to match into a program of their choice in the US because there's an existing demand. Now, we talked about the current situation in the US, healthcare challenges in the US currently, physician shortages, and how foreign medical graduates are meeting some of this demand. Now, keep in mind, this is a huge opportunity that exists currently in the US. I cannot think of any other country where such a huge opportunity exists. To a certain extent, it exists in Canada, but the US offers you a great pathway for foreign medical graduates to get into your postgraduate training program. I'll just explain how the pathway for the medical school journey works, more from an Indian perspective to a US postgraduate program. So after 12th grade, you will enter your medical school or your medical college, get into your MBBS degree, do your internship, and then you will apply for your residency program. The residency program here is your postgraduate training program. Now, I will slightly in the upcoming slides, we'll talk a little bit more in detail about your residency program, application process, and so on, and the requirements. But this is in a nutshell what you're looking at. Medical school runs for around 4 years, and residency, depending on your choice, can run anywhere from 4 to 5 years. For example, your family practice will run for 3 years. If it's an internal medicine, it can be 4 years, and so on. Now, I'm just going to talk about the steps involved in getting into a residency program or a postgraduate training program after you are a medical graduate. First and most important, anybody who is getting into a US residency program or a US postgraduate training program has to clear a USMLE Step 1. Interestingly, this is the same case for even American students. If I'm a physician trained in the US, I also have to clear my USMLE Step 1 to practice medicine or to qualify for postgraduate training in the US. USMLE Step 1, every student has to take it. This can be taken from prometric centers across the world. You can currently take USMLE Step 1 in India from, I think there are a few locations. I know for sure there are locations in Bangalore where you can take your USMLE Step 1, but there are other locations. There could be other locations also. 8-hour multiple choice questions, purely computer based. It covers basic medical science topics, which are more of your behavioral science, microbiology, pathology, anatomy, physiology, and so on and so on. So basic science coursework is tested during your USMLE Step 1 exam. USMLE Step 2 exam, 9-hour multiple choice. Areas relevant to provision of care under supervision, normal condition and disease of particular organs, Physician task diagnosis. Essentially, your clinical training is what comes under USMLE Step 2 CK. CK stands for clinical knowledge. So step 1 and step 2 is required for you to apply for your residency program in the US. Now, there is also a third step to it called USMLE Step 3, which is not a requirement for residency programs, but while you are in residency program, you'll have to clear it for your eventual final license to practice in the US. Once you have cleared your USMLE Step 1, Step 2, the next step is called ECFMG certification. ECFMG stands for Education Commission on Foreign Medical Graduates. It is essentially the body that oversees the foreign medical graduates in the US. Let's say, for example, your National Medical Council, NMC, or a foreign body that manages the physician licensure in the US. It's called ECFMG. You have to clear a USMLE Step 1 and Step 2, and then do your education verification, and then you can get a ECFMG certification. Now, I've seen, when I go to ECFP certification, they give you a certificate which is very similar to your MBBS certificate or a medical diploma, as we call it here. And I've known my doctor when I go to my PCP's office, in his office, right on the wall, I see this huge ECFP certificate listed. So it's as good as a medical degree or diploma. Does not guarantee acceptance into postgraduate training. It is only qualifying you or credentialing you as a doctor who qualifies for participating in the match program or the residency application process. Essentially, it only says that your credentials is as good as a medical doctor in the US. ECFP certification process, online application, medical education credential requirements, and then examination requirements. We talked about it. So this is the ECFG application process. Now, what happens after the ECFB certification process? And that is what I'm going to talk about. It's called the match process. How do you apply for residency program? How do you apply for a postgraduate training program? That is called the match process. So after the ECFMD certification, after you have taken all your USMLE steps, what next? The whole process is called a residency match program. Residency, don't get confused with the word residency. Residency does not mean the permanent residency or the green card or anything. It implies for your postgraduate training. The residency match is called getting into a postgraduate training program in the US, and we'll talk about the steps on what happens at that time. Okay. There is a system called ERAS, Electronic Residency Application Services. ERAS is a so-called application portal where you can log in, create your account with all the information that you have. You can create a system in ERAS for your application. So ERAS, in essence, helps you to submit your application information to residency program. There are thousands of residency programs in the US, and all these programs will require you to submit an application. Now, it is virtually impossible for you to apply to all the 30,000 programs. So ERAS has created a platform whereby you can submit all your documents, and from there you can pick and choose to see where your application should go. I have seen students submitting applications to 25 programs as less as 3 to 4 programs. All this application comes with cost, so that is something that you'll have to keep in mind, and where and how you should submit your application. Now, put all your documents in your ERAS, you submit applications here to the residency program. Residency programs look at your credentials, and the documentation for residency programs includes your ECFMG documentation, MSP, which is a medical student performance evaluation, essentially a profile of you as a medical student, mostly created by the medical school where you graduated, and then your letters of recommendation, and your personal statement and your resume and anything else that you have done. These are documentations. So based on the documentation that you have uploaded in ERAS, you click and you choose a program that you want to apply. You have submitted application to various programs, and then around October time, you start getting invitations for interview. So after you have submitted your application, the programs will see you as an individual. If they're interested in interviewing you as a candidate, they will invite you for an interview. Most interviews we have seen is roughly around 2 days. The day before the interview, you will be invited for a dinner with the residents, and then you have a casual conversation, very informal. And then the next day, you'll have an interview. In the interview process, you could be interviewed by residents and also by the program director. Now, keep in mind, we always talk about, most of you might have heard about externship programs. and people promoting externship program and saying, hey, we have an externship program, ACGME accredited externship program. We have an externship program where there's a residency program. So the advantage is, if you have an externship program done at a hospital where there's a residency program, there's a good chance that you can get invited to interview in the same program, because they know you. If they know you enough, and if they believe that you are a good candidate for the program, that makes your life much easier. So you have externship done, you have done your externship there, they see you as a good candidate, there's a good chance that you get invited to the same residency program. And because they know you, there's a good chance that you can present yourself properly and they will rate you better as a candidate for the residency program. Interviews are ongoing. It happens until around Jan. You go for interview and so on, and then in the month of March, you will be informed of your match success or success into the match program, and say you can whether you qualify into match program or so. So a few things to keep in mind. As a foreign medical graduate, some critical factors that you have to keep in mind. One, we always recommend you to have some externship programs done at US hospitals. Now, why is this important? Your end of the day, your clinical practice is very similar across the world. The way you treat patients could be similar across the world. Why would a US residency program look at a student with clinical training in the US favorable than somebody with a clinical training from, let's say, from Africa, from India, wherever they are from? you know it begins with the simple things, like your personal space, your interaction with patients, communication. These are all key factors that are considered, that are vital for your success as a practitioner. Regulations, guidelines, policies. For example, HIPAA guidelines are all certain restrictions on things that you can do, you cannot do. All these things you are already oriented if you have your externship done at the US hospital. And finally, your chance for success. See, all the residency program or the postgraduate training program, when they recruit a resident or a new graduate into the program, you are their workforce for the next 3 to 4 years. You are their working physicians. So they do not want to take a chance. They cannot imagine a situation by which they hired somebody, recruited somebody, a resident, and they're concerned about their performance. Man, these guys are not able to deliver up to the way we wanted. So they want to be 100% safe, and this extensive program gives you that safety net to showcase you as an individual who has enough background, enough experience in a US training system, so that the residency programs can be comfortable, number one. Number two, if you go through an externship program and if you have a letter of recommendation from a US physician that has trained you, that adds a lot of value here. The whole concept of letter of recommendation has a lot of value, because people don't just give random letters of recommendation. If I'm a physician, just because I know Anita doesn't mean that I'm going to give Anita a letter of recommendation. No, it doesn't. It hardly happens. I will only give a strong letter of recommendation if I believe she can deliver, and she will be a good fit to the program. So letters of recommendation has a lot of value. So if you're in residence, if you're in an externship program, if you're doing well, you have a good chance of getting a letter of recommendation, which will be an added value when you apply for a residency program in the US. So in March, you are informed of your outcome of your residency application process, and then you go from there. Summarizing it, how does it work? ECFG certification, which requires you to take or a USMLE examination. After the USMLE examinations are cleared, after you have a ECFG certification, you go through your residency application process. After you go through the application process, you go through the match process, and you match into the program. And then the programs will apply for your visa for you to live in the US and practice in the US. There are two kinds of visas, H1 and J1. I've seen, I would say, most residency program sponsoring a J1 visa for you, but I've also seen some programs sponsoring H1. H1 is very minimal. J1 is the one that does most of the sponsorship for students. Once you have completed your residency program, you can do fellowship, or even you can go for your post-match or board certification and so on. Okay, I think with that, I briefly conclude our session. It was supposed to be roughly around 30 minutes. I think I've taken around 29 minutes for the session. I'll be more than happy to answer any questions that you might have in relating to our discussion today.
Thank you so much for that informative session. Now, I'm going to allow the participants. I mean, do you want to directly speak with them, or shall we take the questions and then we can?
I'm open for both. If any participant want to ask a question, raise your hand. We can unmute you.
Yes.
And we can answer a question. Otherwise, you can type in also. It doesn't matter.
All right. Yeah. So participants, if you would like to, directly ask the question, kindly raise your hand so that I can allow you to speak. Dr. Pratibha, you had raised your hand previously, I guess. So would you like to speak?
Okay, Satish Kumar asked, what are the process to get into subspecialty training in the US? Good question. After your residency program, we call it fellowship. Let's say, for example, just take an example of cardiology or nephrology as an example of fellowship program that you want to get into. After your residency program of internal medicine, which these are all medicine specialties, after your after your residency in internal medicine, then you will still have to apply further for a fellowship, very similar to the entire match process. You apply for a fellowship program and different programs that are available, and then you can get into fellowship. Generally run for around 2 years or 3 years, depending on what you want to get into. And I'll also add this by saying that this event, as you might already know, is promoted by Texila American University and residency in USA. Residencies in USA is a pathway offered by Texila American University for students for medical graduates to come to the US and practice medicine. We as a university also have our own graduates who are practicing in different parts of the US where we have supported them. So residency in USA is an initiative by Texila American University to support students to get into the US residency program. We offer externships in different hospitals in the US, different ACGME accredited programs in the US, where we offer externship programs. So if you want to pursue your externship program, we can support you with that. We also offer you residency application support services, where we work with previous program directors of residency programs who can review your application, give you some insights on application, do some mock sessions, mock interview with you, and so on, preparing you for a successful residency match process. Additionally, if anybody's interested in USMLE review programs, we have partnered with Kaplan Review Program, where you can have access to your USMLE Step 1 or Step 2 review coursework undertaken. So we offer 3 services: externship, residency application process, as well as your USMLE review program. Satish Kumar, there's another question. He'd say, sir, we are consultants of OBGYN and orthopedics in India. What's our pathway to be licensed in States? Satish, I'll give you a good example of one of my friend. His name is Mohan from India. He was an orthopedic surgeon in India. Everybody has to go through the same pathway. And Mohan is now in St. Louis, Missouri, working as an internal medicine. So he went through the same ECFNE process, start from the all over again. The only good thing is your OBGYN or orthopedics might help you when you submit application to a same residency program, but no guarantee. Your previous training it can only be an add-on, but not sure. So you'll have to go through the entire same process as a fresh graduate, but your application might get some favorable consideration if you apply to OBGYN and orthopedics programs. That's all. Other than that, same process.
Thank you, Dr. Satish. And next question, please. Meanwhile, I would request all the participants to post in your, WhatsApp number in the personal chat so that we can get back to you and provide you more information to your WhatsApp. And if you have any further doubts, we can, connect you with Mr. Shyam so that he will be able to individually answer your questions as well. So requesting everybody to post your WhatsApp number in the individual chat.
Yes, as Anita mentioned, your questions doesn't have to end here. We'll be more than happy to answer any of your questions in the future also. So feel free to reach out to us anytime, even after the session. With questions, we are trying to do more and more sessions. I think there's one planned every month. So similar topics, similarly talk about US licensing and so on. So feel free to join our next sessions also. I think we have another question here. Let's see. Is internal medicine training in UK is recognized by US after clearing USMLE? I did not quite understand your question. I am assuming it is you are asking me after USMLE, can I do UK? You cannot. You will have to take PLAB to practice in UK. Only time when reciprocity works between countries are when you are already a licensed practitioner in a different country. For example, if you're a licensed practitioner in the US, with a license to practice in the US, you get reciprocity in India. India also accepts reciprocity from UK, US, Australia, New Zealand, I think Ireland also, if I remember it right. But other than that, you'll have to go through the same pathway.
Next question, please.
Again, as mentioned, your question doesn't have to limit here. You can always reach out to our team members. and they'll be happy to support you. And if you want to connect with us or even some of our other colleagues who has experience, actually, our provost is Dr. Hugh Duckworth. He used to be a practicing physician in the US, and he's now retired. So, if you have specific questions and if you're interested, we can bring him on call one of these days. He can also give you more information on the residency application process or life as a resident. How does it look in the US? So, every once in a while, we'll be continuing with our sessions, and we invite all of you to be a part of the session. So, leave your phone number, email ID, so that we can be in touch with you and inform you of any other sessions and upcoming events.
Participants, are you able to, type into my individual chat? Okay. Sorry. Now I have given out the permission, and I would request everybody to send in the WhatsApp number and the email address. So can we roll out the poll now? Just with the two questions, I would like to
Yes,
go
we
ahead.
can. I think with that, since assuming that there are no further questions, Sunita, I'll leave the session. You can roll out the poll and take it forward from here. Okay.
Yes, definitely. Yeah.
Okay.
Thank you.
Thank you all. All of you have a good Friday evening and have a good weekend. Thank you. Thank you, Anita.
Thank you. Thank you, sir. Thank you. Participants, thank you so much for attending the webinar. I hope it was informative, and we can still, go ahead and give you a lot of in-person information depending on your qualification, your eligibility, your interest. Um, and we have multiple programs and multiple options and scholarship also, options also in terms of visa assistance and everything we provide you. So I would request you to post in your WhatsApp number as well as your email address in individual chat so that we can get back to you personally and give out the information. So just consider this to be an informative webinar so that you'll get a lot of insights which will help you to make a decision to which pathway you're going to take up for your PG, either in India or US or UK. You can choose. So kindly answer the questions in the poll, and please post in your individual numbers. Thank you.